Callan Giroux is a general adult psychiatrist who specializes in the assessment and treatments of trauma-related conditions. In 2018, she and Dr. Andres Sciolla founded and still co-direct RESTART at UC Davis, a resilience-focused, mindfulness-based stress reduction program for survivors of developmental trauma. She also assesses physicians with burnout and trauma as part of the UC Davis Wellbeing Committee. Her therapeutic approach is eclectic with an emphasis on narrative, existential, and lifestyle hygiene perspectives, and she incorporates expressive writings in her group therapy. Dr. Giroux believes in fostering recovery, self-efficacy, growth by eliciting each patient's inner strengths and creative potential. She authored various articles and sections of books on trauma and serves on the editorial board of Sierra Sacramento Valley Medicine. In addition to her clinical writings, she enjoys poetry and essays in English and in her native French. Please welcome Dr. Giroux.
Thank you so much, Dr. Lisa Raga, for this introduction. I'm going to have Sam Mello advance the slides for me because we ran into some technical difficulties this morning. Do we have the presentation ready? Perfect. Thank you so much. Okay, so today this presentation is going to be about you, really. Your story is going to be in subtext. There will be pauses for exercises, but I welcome to write down your reflections throughout this presentation or anything that comes to your mind. And I would like you to keep your questions for the end. This way I don't get too distracted and I make sure that we cover the materials, but there will be enough time. Next slide, please. I would like to thank the Medical Society for organizing this event, and Sam Mello and Lindsay Coate, who helped me also troubleshoot for the past couple of days, including this morning. Dr. Amy Alfelt, who actually kindly agreed to swap with me due to these difficulties this morning. I want to thank Manchester Library for letting me use their free Wi-Fi connection outside. I'm currently in Manchester. I want to thank Meg Maida, a medical student who graciously offered some of her slides in her ACEs presentation, and my patients who have been my best teachers. Next slide. So I have no relevant financial relationships to disclose. Next slide. As a relatively privileged spiritual who grew up in a Catholic culture, exer, cisgender French-Canadian woman, I'm aware that my perspective and experiences might not resonate with people of different intersecting identities. I hope the audience will forgive me for this gap and yet still find the potential to identify with some of the universals addressed in this presentation, such as being a healer and human beings striving for a healthy and fulfilling life. And by the way, an exer, for the younger of you, means that I grew up in a generation that knew how to record songs in a cassette. And that also means that I'm a digital migrant, and that makes the IT person my best friend. Next slide, please. Okay, so please pay attention to the imagery. And as you read the Carl Jung's quote on the wounded healer, since it's going to be part of the topic, the main topic today. Look at the fragmented image, triangles, all the colors. Next slide, please. And please have writing materials available. As we go through this presentation, I would like you to write down reflections and answers to some questions. Next slide, please. These are the learning objectives. In summary, I want you to look at the implications of your own trauma story, if you have one, within your life narrative, and what to do about that to heal. I'll let you some time to read them. Next slide. Okay, so this is an exercise that I want you to do in 1 minute. And this is inspired by a book that I like a lot by Françoise Héritier, who was a French anthropologist and who wrote Le sel de la vie, which has been translated by the sweetness of life, even though sel means salt. And in this book, basically, it's like a letter to a friend that contains a list of things that she enjoys, such as fixing dates years in advance, the smile of Brad Pitt, the grace of Audrey Hepburn, replying with a smile to the silent question asked by all small babies: who on earth are you? Having an umbrella when you need one, a big enough umbrella for several people, listening to owls by night and crickets by day. And I can give you a few of my favorites: swinging, like this, swing here in the image, and smelling my kids' hair after they went by a rosemary bush, and realizing that I wear clothes that actually match San Francisco weather on any given day. So what about your joys? Okay, so as you know, joy is part of life, but suffering as well. Think about stress that you've experienced but overcome, and think about what helped you cope with the situations. And also what stresses among those situations are still impacting you to this day. And do you know where you're stuck? Are you stuck in a very dense, heavy, difficult emotion such as anger, shame, unresolved grief, repeating patterns, or constant reminders and triggers? So take about 30 seconds to think about that and write that down. So among the situations that might have been stressful in your life, some might be called ACEs, or adverse childhood experiences. I'm not going to go over the whole concept of the study. Most of you are familiar with it at this time. But these are examples. I mean, in fact, there are the 10 ACEs that were used in the survey by Felity and collaborators back in the 1990s. This study came out in 1998 and correlated these childhood experiences with health outcomes and chronic conditions that are preventable, such as you see in this slide. So look at those 10 ACEs and see if you have experienced any of them. And then each ACE is a 1, so try to determine your score in the next 20 seconds. And a way to remember the ACEs as you screen your patients is really to think about any toxic situation in childhood or any stress that might have affected attachment relationship, because attachment is the foundation for everything from self-esteem to physical growth to cognitive functioning to the ability to relate to others. You might notice also that ACEs come in clusters, right? It's rare that people have only one ACE. Usually if somebody is mentally ill, it might mean emotional neglect or physical abuse. So it seems like one ACE could be a magnet to the other ACEs. Think about limitations also of that screening tool. Maybe there are experiences that don't even fit any of those categories. So later the ACE questionnaire was expanded and included things like community violence and bullying, which I think are super relevant since bullying can lead to suicide, as you know. And there's another trauma that I'm thinking about that I see a lot in the populations that I work with that is not really included there. It's the invalidation trauma, meaning when children, when they experience, for instance, sexual abuse and disclose that to a caregiver, if they are dismissed or not believed, often that is actually worse than the trauma itself. That is what I have encountered in my clinical practice over the years. So these are some of the limitations of this screening tool. One question that I find may be more useful than this, if you have limited time, is to ask yourself, but also your patients, were your emotional needs met as a child? And I think it captures quite a lot of those ACEs. So keep your score in mind if you're able to determine whether you've been through some of those ACEs. And you can see what is your level of risk of developing those health conditions, such as risky health behaviors like smoking, diabetes, hypertension, depression, even cancer. So depending on whether you have associated health conditions or not, if you have a score between 1 and 3, you have intermediate risk versus high risk. And a score of 4+ is without or with health conditions considered high risk. But there's something we can do about that. It doesn't have to be a death sentence. Yes, trauma affects the whole person. As you can see, there are physical health conditions, but also mental disorders that can develop over the years after having experienced ACEs. And it's like trauma creates a fracture in the person's life and life narrative, like the Nexus event, for those who've watched Loki. It just creates a new trajectory that was not anticipated. But ACEs or trauma are not necessarily set in stone in terms of what comes after. You have some control and healing is possible. We just need to work on mind, body, and soul integration. Next slide. And the first step is actually self-compassion. It's really recognizing that there was nothing you could have done to change that. You were a helpless child, you tried to survive, and you were not sufficiently protected when this happened. So how do we practice self-compassion? I honestly am still working on it, because if you chose medicine, probably you have an ability to express empathy, but empathy can lead to burnout. Even though we talk about empathy, compassion fatigue, it's actually empathy fatigue, because empathy solicits different brain structures, such as the amygdala, and this is implicated in the stress response system's activation, just like in trauma. So basically, it's living the suffering with the person we're in front of. So there's such resonance with that pain of others that it can lead to emotions that are difficult, such as sadness and fear, emotional exhaustion. Compassion, on the other hand, activates the reward centers of the brain. It's energizing rather than depleting, and it's associated with positive emotions. It enhances the immune function as well, and it's unlimited. So that's why we need to shift from empathy to compassion. And Mathieu Ricard said it beautifully when he wrote, "When altruistic love passes through the prism of empathy, it becomes compassion." So we need to add a little bit of love there, self-love, to lead to self-compassion and ultimately compassion for others. And the emotions are felt even when we're compassionate, but there's a little bit of detachment and distance associated with that, so it's more bearable. In order to heal, one must feel. So we don't have to run away from emotions. We shouldn't, in fact. Next slide. This is a great book that I really enjoyed, and I think the author really said it well when he talked about unpleasant emotions. I don't want to say negative emotions, because I don't think there's no such thing as a negative emotion. Emotions are there to invite us to go in a direction for healing. They're just telling us that there's something in that's not balanced in our life. They're messengers. They're like our compass. So pay attention to what they're telling you. So they have important messages. So they are either pleasant or unpleasant. And if they are unpleasant, such as sadness or fear, nurture them as if they were a screaming infant. These are other great books that I've enjoyed. As you probably know by now, body is like a messenger, right? The body keeps the score. The body remembers. It's actually, I'm currently at a retreat, and it was talked about how the fascia in our body is the location of trauma. This is where we need to intervene to liberate the trauma in ourselves. It's really physical also, the trauma. It even affects our genes. The body speaks through illnesses. Maybe think about patients you had who had symbolic expressions of their distress, whether it's like some sore throat or some issues with vocal cords. Maybe they had lost their voice. Maybe it was a way to express that they needed to reclaim their voice. So just briefly, I do not want to pretend that I've done an exhaustive and comprehensive study on the subject, but there are some considerations when it comes to race and gender regarding ACEs. Again, maybe it doesn't capture the reality of certain ethnic minorities or the full gender spectrum. I remember very well in med school, and that was back in the 1990s, when we were studying internal medicine or physiology, it was said in the epidemiology, for instance, that Black people were more likely to have hypertension. And they didn't say why. And it was like, okay, well, is that part of their constitution or genes or whatever, you know? But then later on, as I started working with the socially disadvantaged, including Black people, I realized that, well, they were maybe more traumatized than others, right? Because of the ongoing trauma and discrimination. So over the years, I wondered if the ACEs were overlooked. And at that time, I was not thought about ACEs, even though the study came out in 1998 when I was in the middle of med school. So people had not made that connection yet. But it's important to realize that there's a mechanism and we need to address that mechanism. So we have to understand, why are there differences? Also, Black people are disproportionately diagnosed with severe mental illness rather than trauma-related disorders. That I see in emergency room when I'm on call all the time. And it's heartbreaking. People receiving these severe diagnoses, therefore not receiving appropriate treatments, that perpetuates a stigma, a poor quality of life, potentially harmful consequences from medications and treatments. And also depression. So I also learned when I went through med school and residency that it is twice as prevalent in women versus men. And you internalize that fact and you think, oh my gosh, is there something wrong with women, with me, right? I mean, I'm more at risk than men. Why is that? So it's, again, you have this sense of inherent defect or disadvantaged, and it gets caught or perpetuated in the narrative without trying to understand why. So it's like, we have to accept that. No, wait a minute. Why is that? Also, autoimmune disorders, which can be a manifestation of untreated ACEs and trauma. You know, people with arthritis might have more frequent exacerbation of their condition because of stress, because of trauma. And trauma can affect the prognosis. So why autoimmune disorders are prevalent in 75% of women? Why this major discrepancy? Why more women? Because think about it, autoimmune disorders, it's like the body attack itself, right? So it's really disturbing to think about this. What is the symbolism there? And in her book, Kristen Northrup talks about energy vampires, which is another term for severe or pervert narcissists. And she mentioned that there was a correlation between women who had been in toxic relationship and autoimmune disorders later. Also, ACEs and medical students. So why the wounded healer? Well, we know that a lot of people going to med school and even vet school have suffered ACEs. In one study done by Dr. Sciolla at UC Davis and collaborators, 10 out of 86 participants, 12%, had an ACE score of 4 or more. And all of them were women. So why? Next slide, please. It's unfortunate that it's easier to blame non-modifiable characteristics than injustice and inequalities, which we can do something about, actually. Injustice and inequalities, right, can be changed. Black people are still suffering from ongoing discrimination on top of transgenerational trauma. Like I said, trauma gets passed on in genes. Stress affects the telomere length. And also in the family myth, what is not talked about can get repeated over the generations. There are reenactments, and I see that in my clinical practice. I've seen that around me. If an issue is not addressed, if it's taboo, if it's repressed, we might see that in subsequent generations. I was talking about women being diagnosed with depression more than men. Well, the reality is women are more often victimized. If you remember the study with the med students, an ACE score of 4+, mostly women in that case. And also MDD is a form of chronic PTSD. So look at the criteria for PTSD. And there's an overlap between depression and PTSD. You might have a depressive syndrome without the re-experiencing, and you might miss PTSD, but maybe it's residual PTSD. So it's always important to screen for trauma in people who are depressed. Also, because women are socialized to put others' needs first, there's an inevitable depletion of inner resources. And think about chronic stress, the cortisol levels, and how it might destroy cellular cells and be damaging, and that lead to chronic inflammation. And think about your own medical illnesses and past medical history, and see if you can identify with any condition and make a correlation between maybe past childhood trauma and a chronic illness. Next slide, please. So there are other conditions that can develop from chronic inflammation. I will let you read them as we do the third exercise, what is your medical autobiography. So owning your vulnerabilities, becoming self-aware can be a source of unique insights and momentum. It's the only way to heal, actually. Remember, one has to feel in order to heal. But there's a positive associated with adversity. If you're here, it means you survived. And what happened, or what did you do to overcome the adversity? Think about that. That's a fourth exercise. And also, what are your current obstacles to healing and self-care at this time? Think about those areas where you feel like your life is not quite in balance. What are the health issues you're struggling with? And what prevents you from addressing those? And what is your barrier removal plan? So think about it for 30 seconds and write that down. Are you an empath? I talked about empathy and choosing medicine as a path earlier. It's very likely that you are. It's not necessarily a bad thing, but it might make you extra sensitive and a magnet to people who might suck the life energy out of you. So if that is the case, it's time to learn boundary setting. So boundaries really help us keep staying safe. And this is a concept I hadn't heard about until I started working with patients whose boundaries had been violated. And then I realized, oh my gosh, my boundaries have been violated over and over again. That's why I was so frustrated or upset or this or that. So boundaries are either physical, your body. They concern your time, how you manage your time. So some people might just interfere with your schedule, your biorhythms. Mental, such as your belief system, your thoughts. Emotional safety, your emotions, feelings. Material, including financial. So think about those boundaries and ask yourself if they are well defined. If they're not, it's time to wonder what they are and assert them in order to preserve yourself. That's part of self-care. And in order to deal with the guilt associated with saying no, because as doctors, we want to help and we might have difficulty saying no. That might be part of the mechanisms for burnout. There was this quote from the person at the retreat where I am currently. She said, "You are not the only possibility in the universe." So think about yourself as not totally indispensable. It's not the end of the world if you can't do it. Somebody else will. Another way to deal with the fact that you might be highly sensitive or empathetic is schedule your worry time. When we're empathetic, we might just be overwhelmed with other people's problems and our own. So make sure you limit that worry time. So that's another trick from a presenter from last fall at the Wellbeing Committee. Just put that in the schedule, maximum 15 minutes, and just ruminate about the issues and then move on. So it's important to structure even that in your day. Next slide, please. And remember, like I said earlier, you survived this. So you're an overcomer. You're a self-healer. So think about those obstacles and think about the next chapter. You have to be the hero of your story. You're the main character of your life. You are the conductor of the orchestra of your life. You're the CEO of your time. Put yourself back in that role. Imagine the best. Imagine positive outcomes. Believe in them, and they can materialize. Thoughts are our environment. Thoughts often determine how we feel. It's important to choose your thoughts wisely. So, have you thought about what are you going to remove as barriers and what are you going to do for self-care? You had wonderful talks earlier that helped you with some major, principles, how to implement self-care, how to take care of yourself. It's okay to not succeed at that. Sometimes we feel like we're a failure when we're told, oh, you're resilient, and we don't feel like it. I think doctors have come to hate that word, actually, so I avoided talking about it in my talk today. And when we meditate, sometimes we feel like, no, I can't concentrate, I can't be in the moment. That's okay. If you're aware of it, that means you are practicing meditation. So don't beat yourself up. You can fall apart also. That's part of being a human. And do it well when you do fall apart. What I mean by that is trying to not take yourself too seriously and look at this reaction as if it were happening to a character of your favorite novel, and how would you make it happen to make it entertaining? So why not having a little bit of fun? It's important to include humor in all of this. You can even schedule a breakdown time as needed, just like the worry time. I've heard also from a psychologist that it's important to swear to increase the threshold for pain, actually. So go in a closet and do that if you need to. Swearing has a function. This is where I am currently. And I wanted to demonstrate that I'm practicing what I preach. I'm at a retreat with 9 other wonderful physicians, one of whom I had known for a year only virtually, but the other ones I had never met. Just to emphasize that it's important to meet other doctors from other specialties, other backgrounds, to connect with deep values, to connect with what made you choose medicine, to heal together. We talk a lot about trauma and how it affected us and how we practice medicine, how we might get easily burnt out. And connect with those people, and you might see that you have a lot in common, and you might share some, spiritual beliefs, and some of them are medical intuitives, using their intuition a lot in their practice. I think we're talking more about these things, trying to integrate Eastern medicine with our Western practices. I think it makes medicine more holistic. We're not just bodies, we are embodied souls. So that's important to make time for that. Next slide, please. I talked about Christiane Northrup, who wrote Dodging the Energy Vampires. This is what I found on her website, 7 action steps to help you heal. I thought that was summarizing really what I think is important. Uncover and update your legacy. So know your history, know your transgenerational patterns, do your genogram. That can be a very eye-opening experience, to write down the family tree and all the facts and illnesses and traumas, migration, etc., what happened, divorce, etc., and see if there's a pattern. And you can update it. That means you don't have to repeat what happened to you, right? What we don't know, what we don't remember, we are at risk of repeating. Sort through your beliefs. Make sure you think positive thoughts, and make sure you connect with what is really important to you. there are times when I get really irritated by medicine or the system, the healthcare system here in this country. I've been trained in another country where there is socialized medicine, which, by the way, is not bad. Socialized is good. It's universal. Anyway, so I often complain about the corporatized type of medicine we have, and the heavy admin duties and the tyrannical in basket. And sometimes I'm just in this rebellious phase where I decide to not respond to everything right away, because everything becomes an emergency. So how are you going to deal with all these emails or reminders, etc.? So really pick what's important to you, and think about, if you were in your deathbed, would you care about your in basket at this minute, right? Would it matter if you hadn't finished co-signing all of that? If it's not a life or death matter to someone else, why would it be for you? So give yourself time to not respond to things. It allows you to be mindful. And it's important to have a space between activities and experiences, not answering the phone immediately or pick it up when it rings, but just finish what you were doing. Give you some transitions between activities, a block of activities, or even patience, if possible, just to help you switch gears. It's important to have space between experiences. Change your relationship with time. You have more time than you think. Yes, we have this life to live. We want to make the best out of it. But you realize that as you slow down, as you're more mindful, life becomes full. Life becomes full, abundant, and you feel like you master time better. You're not the slave of time, but time becomes your friend and your ally. Respect and release your emotions. We talked about that already. Learn to listen to your body. Your body is your friend also. It's your best friend. It's your house. It's your temple. So be respectful of it and be thankful for what it tells you. It's there to help you. It's there to tell you have to slow down. You have to sleep more. You have to have more supportive relationships. You deserve it. Understand that you are not your genes. So that's another thing, right? We are told, oh, this is a disease with a strong genetic component. And then you look at family history. It's like, oh my gosh, I'm doomed. Everybody's an alcoholic. Everybody's bipolar, blah, blah, blah. No, it takes something to turn on those genes, and you have control over what turns them on. So focus on nurture rather than nature. And acknowledge a higher power. I think it's important to see the interconnectedness of all beings, to see that you're not alone. And find that source, whatever it is, that helps you keep going. Next slide, please. So self-care and resilience, 10 themes. This is another approach if you want to really a checklist of elements that help you maintain self-care. Next slide, please. I talked about emotions, how it's important to pay attention to them. It will help you also break the cycle of traumatization in medicine, because when we talk about trauma-informed care, that means we need to acknowledge that our patients come with trauma stories, and we don't want to do anything that might trigger them. So what do? When we have an emotion, whether it's pleasant or not, we just pause and we listen to it. What does it have to tell us? So we become more self-aware, we become more observant, curious, interested, and that means that we see joy also. Joy is more noticeable when we pay attention to everything. When we're mindful and joyful, it's easier to have compassion. When we have compassion, then we're able to think about other people's thinking better, right? We can mentalize, so we can do our jobs better as we relate to others and our patients. And then we mentalize, it's easier to validate and support, and therefore it minimizes the risk of traumatization. Next slide, please. Tara Brach has great free meditations on her website. I use them personally. And she has this acronym, RAIN. Recognize what is happening, allow life to be just as it is, investigate with a gentle, curious attention, and nurture with loving presence. So I encourage you to practice that. Maybe have a pledge to yourself that you recite every day to make it, more ingrained and anchor yourself. Next slide, please. Reframe adversity as constructively as possible. So that's kind of my approach with my patients in narrative therapy groups that I lead, trying to use trauma as an opportunity to transform ourselves, to transcend. So you can tell yourself what the trauma taught you, like, oh, it taught me what love isn't. I discovered resources I didn't know I had, etc. So find a positive, even in the most horrific event. Well, there was somebody actually who listened to me, who supported me when I needed it the most. And it helps put things into perspective. So we won't have time to do this reflective exercise. We'll have just a few minutes before questions, but think about that positive element in your trauma story later today, maybe, or when you have a moment, and write it down. Next slide, please. We also need to move out of our comfort zone to heal. So that helps us increase tolerance for uncertainty and move out of comfort zone. And I really like that quote from André Gide. Next slide, please. So joy of medicine, that's a theme of the summit. I encourage you to cultivate joy. This is contagious. It brings a positive and healing into the world. It doesn't cost anything. I have a friend who distributes compliments, and it's such a great thing. It makes you happy to make someone happy, and it's free. It doesn't cost you anything. So try to notice something that you could compliment a person about. Next slide, please. So these are the ways that I encourage you to try if you want to cultivate joy more, or mindfulness, notice, find, create beauty, practice gratitude, and maybe go back to your list of joys, because that includes things to be thankful for. Let go of the outcome. That's very important, because the outcomes is just the world of form. And be a conduit for creativity and love. That's way more important. Be around joyful and positive people. And I can tell you, people who are very relaxed. It helped me actually, especially today, that there were so many people around me who were helpful to deal with the technical issues. So make sure you select your network. And I like Frédéric Lenoir's quote, "The instant makes us touch eternity." So that's what mindfulness does. It will help you have that sense of limitless time. Next slide, please. So we don't really have time, unfortunately, but create your meditation or joy menu. Just as we feed our bodies 3 times a day, why shouldn't we do the same for our soul? So make sure you have a list ready, because when we're under stress, we can't really think clearly. So just go back to that list and change modalities, because we have hedonic adaptation. So sometimes eventually we feel like it doesn't have the impact that it used to practice an activity. So make sure you rotate and change activities once in a while. But moving is important to move energies and heal. Yoga actually decreases inflammation, for instance, and Tai Chi. Next slide, please. This is just other principles. Self-care is holistic. Don't let anyone tell you it's selfish. I've heard it, but I kept practicing self-care, and you will give from the overflow. Give yourself, you'll give others from the overflow. Only you can take care of you also. And set boundaries and combine modalities as needed. I find meditation easier to do in group. Next slide, please. So we won't have time to go into this, but yeah, some people talked about the pandemic, and I'm wondering how it will affect ACEs. And we know that domestic violence increased during confinement, unfortunately. So continue to think about trauma using the lens of transformation. How are we going to help our patients transform from that collective trauma? We all need the collective healing. Continue to address inequalities as well. And let's use our privilege to help each other. Next slide, please. So I have these quotes that I wanted to share after that. Anyway, create a nexus event. Like I said, you have control over what's coming next, right? You have to move away from the time life created by ACEs and trauma. You are in charge. Find that positive by having an external event that you notice that will meet your internal push. Next slide, please. because it's time to reclaim your body, your beliefs, your intuition, gifts, identity, freedom, and power. Next slide, please. And therapy, I cannot emphasize enough the importance of that, because you relate to a person in a safe setting who can listen to you, help you process your difficult emotions, and help you manage triggers as well. Next slide, please. So this is what I do, storytelling. We do that to restore wholeness, gain perspective, bring closure, transcend an event. And that's what you've done today by taking those notes. Next slide, please. So, people who have experienced trauma, they have this sense of fragmentation or dissociation, of disconnection. They feel like they're broken. But think about the kintsugi, which is the Japanese art of repairing broken pottery by putting a gold lacquer or glue. And it's actually a more beautiful and unique product than the initial pristine pottery. So think about your soul as having not scars, but those golden lines that are so unique. So you're a piece of a puzzle, actually, that will connect and into a mosaic and solve the enigma of your life, give meaning to your life. So we're not fragments. And I don't know if you remember the image from one of the first slides with Carl Jung's quote, but see your ACEs or trauma not as broken glass, but as stained glass that can let the light in the cathedral of your life. Next slide, please. I like that quote. I'll read it for you. It was on social media and I had to put it there. We must not give up. It takes so much time to heal, because we are not just healing our own wounds. We are healing the world's wounds too. We think we are alone with our stuff, but we aren't. With very clearing of our emotional debris, with every foray into a healthier way of being, with every excavation and release of old material, we heal the collective heart. So many of our familial and karmic ancestors had little opportunity to heal their pains. When we heal, their spirits breathe a sigh of relief. We heal them backwards while healing ourselves forward. We heal in unison. Next slide, please. I'm a big fan of Wonder Woman. And I thought that this quote by Danielle Saint kind of represented her spirit and a core value of love. If you wish to be a warrior, prepare to get broken. If you wish to be an explorer, prepare to get lost. And if you wish to be a lover, prepare to be both. I think doctors are warriors, warriors of peace and justice. But that means we can get broken because we are in the front lines of suffering. We are also explorers, right, of the human body, of the human mind, of the human soul. We're trying to understand, how does that work? How do we heal? So it's impossible to not have love inside of us when we have those characteristics and goals. Next slide, please. And this was the concluding quote from the movie Wonder Woman. So Diana said, "Now I know that only love can truly save the world. So I stay, I fight, and I give for the world I know can be." We are doctors because we love serving others. So I think once we can see the good in adversity, like broken leads to warrior and lost leads to explorer, we can access this infinite well of love within us. And love can do magic. It's interesting that I'm in that place that's considered sacred land, mystical land, where I think magic, or some people think magic, can occur. And I think it did happen this morning when I had so many obstacles and technical issues. I think everything fell into place as it needed to. Think about body, mind, soul. How are you nourishing all of those dimensions in your life? They're all important and they all fit together. And how are you going to go from wounded to wounded healer to healed healer? Next slide, please. This is another resource that I recommend, besides the books that I presented throughout. This is a free online wellness resource with modules that you can go through if you'd like. And it's a collaboration between various universities, including UC Davis, and some residents have participated in it as well. Next slide, please. And this is another free resource from Harvard trauma program, a 10-point toolkit and pocket card. Next slide, please. And then time for your questions. Thank you so much.
All right, let's have a big round of applause for Carolyn. So much good stuff here. And not just your expertise, but bringing in the voice of so many others in your action-packed presentation. Thank you so much. That was lovely. You talked about how trauma can create fractures in our lives and change our trajectories, but you also said that healing is possible through compassion. And I love what you said about how none of us is indispensable, which is an incredibly liberating thought. And you talked about how we need to have a plan for well-being. And I love the way you weaved in so much Eastern ways of thought and being. And I love the way you're modeling for us self-care and carving out time for us and for yourself this weekend.